Good evening, everyone. Welcome to Virtual Shadowing Session 91. Tonight, we are joined by Dr. Manny Ohabunwa, as he will be discussing his journey and battle with name-based microaggressions. Next slide, please. Here is our working group composed of Taylor, Rohit, Kiana, Elena, Cheyenne, Ali, and myself, as well as our physician directors, Dr. Fowler, Dr. Salazar, Dr. Wynn, and Dr. Reno. Next slide, please. This month, for our upcoming sessions, next week, we have a specialty spotlight in internal medicine with Dr. Richard Wynn.
Didier, let me interrupt. I want everybody to tune into this, all of you students out there now. Dr. Wynn is a PhD biochemist working in the Department of Internal Medicine as an associate professor. I want you to come and listen to what he has to say about alternative approaches to education, to helping people. This is a biochemist specialist who works in an academic department of internal medicine, just to show you that there are plenty of ways to help people other than going to medical school, nursing school, NP school, and PA school. So, and he's a wonderful speaker, and he's with me on the admissions committee at UT Southwestern. So you'll thoroughly enjoy Dr. Wynn. He goes by Max. So please join us next week. Go ahead. I'm sorry, Lydia, go ahead.
No worries. On the 15th, we will have our 92nd session, A Journey of an Emergency Medicine Resident with Dr. Chris Riley. Next slide, please. For those of you that are new here, we have a quiz following each session to account for your attendance and participation in each session. It'll be a 10-question multiple choice quiz, and upon passing with a 70% or higher, you'll be prompted to download the certificate. Please make sure that you do download that, and you will have 1 week to complete the quiz. As an extra incentive, we've recently started reopening an old session quiz, and we'll share that link with the students in the live sessions at the very, very end of our session after our final Q&A. This week, we'll be opening session 15, and keep in mind that this session quiz link will not be shared outside of tonight's meeting, so please make sure that you stay till the very end. Next slide, please. As always, we'll have 2 Q&A sessions, one at the middle and one at the very end. Please do not direct your messages to myself or Dr. Ohabunwa because they may get overlooked. Next slide, please. Dr. Fowler, would you like to say a few words?
Welcome to Virtual Shadowing. It's so good to have you all back, all nearly 300 of you. It's a pleasure every week to join you. We have an exciting guest tonight that you're going to just absolutely thoroughly enjoy, and I'm so excited that Dr. O is joining us presently to talk to us about some critically important issues as we all are involved in learning applied science to help the human condition. This is our 91st session. We've been going a long, long time now. We've had 62,000 plus students sign up on the website, and we've had over 510,000 viewings of the programs. In this past academic year, in the admissions committee season, which I serve on, as many of you know, here at Southwestern, we found that many, many students, probably 25%, present online virtual shadowing hours of all the different folks who produce this stuff. And it's widely accepted now on the admissions committee. So we're here for you. We're going to keep being here if you keep coming back. We're filling out the calendar all the way into May with some terrific people, including one of our past chairs of the admissions committee who will come in May. And we have some other very exciting guests. So we're just looking forward to filling out spring and being with all of you week after week. So really, very, very much thank you for coming. We really appreciate it. It's a personal pleasure and gift for us to be with you each week. Aditya, would you introduce our terrific guest for tonight?
Yes, sir. Without further ado, it is my pleasure to introduce Dr. Manny Ohabunwa as he shares his journey in medicine and teaches us what named-based microaggressions are and how we can avoid them. Dr. Ohabunwa, please take it away.
Thank you so much for the opportunity. Can you hear me? Can everybody hear me?
Yes, sir.
Fantastic. Yep. I am so excited and honored to have this platform to speak today. Thank you so much to Dr. Fowler, who interviewed me to be at UT Southwestern and now has invited me to talk. It's such a pleasure. And I'm excited to be chatting with you guys about my life and my journey through medicine and battles with name-based microaggressions. If you don't know what that is, you're going to learn about it I am an assistant professor in the ED here at UT Southwestern, and I'll tell you a little bit more about my story as we keep going. So without further ado, I am Nigerian, if you couldn't tell by my accent. There's a little bit of an accent that still shows up. So I was born in Lagos, Nigeria. I grew up in an environment like this, actually. My parents were pastors. And they, at a young age, took us on a lot of mission work with that desire to show us that you don't have to have a lot in order to give back to the communities. My dad always wanted to be a doctor, and because of the corruption in Nigeria, could not do medical school. And so I felt like he named me Emmanuel. His name's Emmanuel too, just so that he can get all the degrees and become a doctor by de facto. But just kidding. But yeah, so I knew about medicine from a young age because I felt like it would give me that opportunity to do more in terms of the mission work my parents were doing. So I grew up in that environment. And then I went to military boarding school in Nigeria. And it was everything you'd imagine, very intense. We woke up every morning at 5 a.m. We had morning chores that we had to do. We had formations, we had siesta, we had, like morning classes, afternoon classes, everything was regimented. I truly did not like that experience. But as you will learn about me, I try to think and I subscribe to the principle of positive reframing in the sense that whatever you see, the question is, what can I learn from it? Not necessarily how bad it was. So when thinking about my experience in military boarding school, the lessons I learned were discipline, work ethic, and time management at a young age. And these were skills that helped me to do really well later in life, because the discipline to get work done, because you only had a certain amount of time to do anything during the boarding school. Aside from that, you were running around, you were doing some chores, you were washing someone's clothes, or doing various things, but discipline, work ethic, and time management. Thankfully, we got rescued. And we moved to the US when I was 13. This is a picture of our first Christmas with my siblings. And that transition again was very, very difficult because I was coming in, to an environment where I guess people, had seen Africans in the movies, and, whatever was seen in the movies was kind of what their expectation was. So I got bullied a lot, called names, African booty scratcher and various things like that. And I was like, this was the first time I had had that kind of experience. One story kind of hits home, and I'll explain why I'm telling this story. I remember walking towards a bus at the end of school, and one of the kids that had been making fun of me walked behind me and punched me in the face and yelled African. I remember turning around and looking immediately at the bus driver, who didn't do anything. And it took everything in me not to run and beat him. But remember, I talked about how I wanted to be a doctor. I knew that I needed to have self-control. I knew that as a Christian, I wasn't supposed to go hit people. I knew that if I got a record, I would probably be in trouble and I'll probably not be able to get into medical school. And so all of those thoughts flashed in my head, and I stopped myself, and thankfully I did. I walked into the bus. I cried like a baby, just really, really frustrated that I couldn't do anything. But there was a lesson associated with that. And the lesson for me was that I will, and you will, and many of you have encountered adversity as you work to reach your goals. Do not let any of it stop you. So I had experiences like that, and those things really taught me the importance of dealing with adversity. And after that middle school experience, I went to and got into a high school for health professions. So the Bakey High School, I don't know how many people are from Houston, Texas. I wish I could see the chat, but I'm sure there's a good amount of y'all. So go H-Town, the city of Beyonce. but it was night and day. It was a lot of fun. I had a lot of students, classmates who were from diverse backgrounds, and I really enjoyed having that diversity of thought, that diversity of exposure, and it just made for a very well-rounded experience. Um, Going to a high school for professions was fantastic because every summer we spent time in the hospital. Every year we were taking classes like intro to health science, intro to medical terminology. Some of these things, these lessons I still use today, in terms of being able to decipher words that I might not know the exact meaning, but I can decipher that itis means inflammation. And so whatever itis is an inflammation of something. So various things like that. But the lesson I learned during that high school experience was, one, seeking diversity in whatever I did because of the diversity of experience, and two, spending time in the area that is important to me. So for me, being a doctor was very important. And so spending time in the hospital every summer, initially I was volunteering to like pick up stuff for patients. I would, take towels. I will take water for patients who needed water and various things like that. Later on, I was shadowing physicians. I was learning. I did neurology, neurosurgery. I did various things like that. So it was such a great experience. And I see a lot of students even now who, when I advise them about medicine, the first thing I do is like, go do some shadowing, talking about a lot of these people who have been shadowing Dr. Fowler. Find an attendant, find someone who you connect with, and shadow them and learn from them. Other options include working as an ED tech, working in EMS, or working as a scribe. These are all ways to make money while also learning medicine. So I went through the high school for health professions, and thankfully, the one school I actually applied to outside of Texas, Johns Hopkins University, I got in. And and this is a picture because this is actually during my graduation. And this was me hugging my mom after I'd walked. And it was one of the most beautiful moments because she, just like my dad, had been my greatest, biggest supporters. And so having them just celebrate this with me was just the biggest joy. So, well, how was my time at Johns Hopkins? So I studied neuroscience and psychology. I wanted a 4.0, but I got a 3.98, so I was pretty disappointed. I got Phi Beta Kappa, got a full ride scholarship, and got into every medical school I applied to. I say this not because it's necessarily important, but I say it because I think the question is more of how did I do it and what did I do? So the first step was applying to lots of scholarships. It surprises me how many scholarships go without applications, because people get deterred by essays and various things. So one of the scholarships I applied to was the Gates Millennium Scholarship. And it had like 15 essays. And so for most people, it was like, oh, heck no, I'm not about to do it. But I saw it as, okay, a lot of people will probably not apply to it. So I'm going to put in a lot of work, sent the essays to a lot of friends to read. And guess what? I got the scholarship, and it was $300,000 worth of money that was sent to me that helped me go to school and have enough to like send money to my parents and various other endeavors and donate and do different things based on the scholarship I got. So the main thing is apply to more scholarships than you think you need. And put in the work, put in the essays, send to a bunch of people, because they will see things that you might not notice. They will see errors that you might not notice and really help you in order to get the best, put your best foot forward. Now, other things I did in terms of getting into medical school, I approached undergrad with a very detailed plan. I was like, I want to do really well. How can I do really well? Well, the first step is figuring out my learning style. So like that first semester, I discovered that I was an auditory learner. I like to listen to things, and every time I'm hearing things and hearing lectures, I start visualizing the lectures. And so I immediately proceeded to recording all my lectures in class and listening to them later on. And that really helped me to do really well on tests. The second thing was study groups. So like I formed a bunch of study groups with uh, with people who were nerdy like me, who were very interested in doing very well in school. And so you didn't feel bad during Friday nights or like Saturdays or whenever where you had to study. But you already had this group of people who were very interested in doing the same and doing as well as you did. And then the other thing was creating a friend group interested in medicine. You know, at Johns Hopkins, it was like a pre-med factory. And so it was kind of easy to find a lot of people who were interested in medicine and to work with them. And so it was good because now you have people who are sharing resources saying, hey, have you taken exam crackers? Or maybe you should do Princeton review, or maybe you should do this. Oh no, I hated this. You should use the other one. And so you had this group of people and this community of people who were like-minded, who were interested in the same things that you were interested in, and who were going to help you to achieve your goals. So those were the first things I did. The other things I talked about and I did was, focusing on the extracurricular activities. My approach for extracurricular activities was looking at things that I like, but can make a difference in the lives of others. So for example, many people who know me know that I love basketball. Thankfully, I'm pretty good at basketball. And so a group of friends and I were like, you know what? We can use basketball as a form of mentoring for high school students. So, the organization started Crossover Basketball, where we would go to high schools around the Baltimore area, play basketball with the students, and then use that as an opportunity to talk to them about career goals, talk to them about school, talk to them about studying and various other endeavors, and showing them that there's other pathways to becoming successful than they might not have been exposed to in the past. And so that was one of the things we did. I did the research stuff. I did a lot of shadowing, but I just found activities that I felt were very interesting to me, and then made a difference in people's lives. And the reason I say that is because then you are more likely to be committed to those activities. I looked forward to my sessions with my students because they were so much fun, and they got me exercise. And I made a difference in the lives of these students. I get messages from them even now of them going into medical school, of people going into becoming ultrasound technicians, of people doing PA school, people doing various things in the health professions just from playing basketball with them and teaching them that there were multiple other avenues to becoming successful in life. Obviously, we can't get away from scores. Scores are important. Doing the best you can in tests. I used to, before every exam or most exams, I would take a practice test, mimicking the situation and the scenario in the of the lecture hall. And it was so helpful because when I would get into the actual exam, it just felt normal. It felt I wasn't nervous because I'd already gone through that practice session. And then the next thing are mentors. I was blessed enough to have sought out mentors that had such a huge influence in my life. I think about in college where I had a mentor called who was one of my professors in neuroscience, and he was one who, as soon as I did very well in his class, and so he was like, "Who's this kid?" And then from there on, we worked together on various projects. He pushed me towards towards research. He pushed me towards what kind of applications. I remember one time I was asking, I was like, hey, I'm not sure when I want to take my MCATs. I don't know if I'm going to have time. I don't know if I'm going to have the money to pay for a class because I don't think I can afford it. He immediately just said, wait, I'll just pay for a class for you. I was so surprised, but this was someone who, it's so surprising to have a mentor who is so committed to your education that he was like, yo, I'm going to pay for this class. And I ended up doing really well on my MCATs because of the class, and the rest was history. The point of this story is not to expect your mentors to pay for your classes. Please don't go expect money from your mentors. But the point of the story is that there's a huge importance of mentorship and finding people who you can give value to and who bring value into your life, and surrounding yourself with those people will help you in this journey towards medicine. And then the final part is having this cohesive application. And these all kind of lead towards it, because when you do extracurricular activities that you're passionate about, you're more likely to stay in these extracurricular activities for a long time. And therefore, you are not going to be, because some of these applications have activity salads, where someone does an activity for 3 months and then another one for 3 months and another one for 3 months. And you're just like, there's no commitment seen in this application. And so one of the things I was really focused on was doing those activities that I really loved, doing those activities that made a difference in people's lives, and being committed, having leadership roles in those activities. And those kind of made for a very good story of my application. So those were kind of my tips for getting into medical school.
So Monty, one of the questions that popped up, which I've answered, but I wish you'd comment. How did you find mentors? Were they just there, or they were around you? Was it your teachers, your family doctor? I mean, who was it that you found that wanted you to reach out to them and that you bonded?
Yeah, so I think finding mentors it can be difficult initially if one is shy, but the thing is just looking at people. So for example, I was interested in medicine. Excuse me. I looked at people who were doing the things that I wanted to do. So I had a mentor who was a researcher at the med school at Johns Hopkins. I looked, she seemed very nice. She seemed like she had worked a lot with a lot of students, and she had helped them to get to the places they needed to go. And I reached out to her and I was like, hey, I know you're very involved in research. Do you mind me coming in to shadow you and to learn a little bit? And it was very easy. She said yes. And she was very, very helpful, wrote me this fantastic letter of recommendation that I was like, who the heck? Oh my gosh. Okay. So this is fun. We have a fire drill in my apartment. So I'm not sure how we're gonna go about this. I did not plan this at all.
Yeah, Monty, take 2 or 3, and let's see what happens with your fire drill. In the meantime, we have already gotten 10 really good questions that have been posted to us. One of the questions that was posted is, what have you enjoyed most about being a medical school professor? And being a medical school professor, I'll take that. And I will tell you that there are 2 things for me, and I'll bet Monty, and hopefully his fire alarm will stop. For me, it's been 2 things. In the academic setting, I have really made the best friends of my life. Many of you have heard me say this over the past couple of years. I really get to work with terrific people, and not only about the fact that they're just nice folks, easy to get along with, non-judgmental, very supportive. They enjoy sharing a mutual friendship, but they are also committed to education and both sharing what they know while supporting students and residents who are in training. as well as learning together. It's a mutual learning platform. And I think one of the things that's really required of a medical school professor today is to be willing to say, I don't know everything, but I am sure willing to learn. I think many of you have heard me say many times that if there is something that I don't know when I'm seeing a patient, there's one of three reasons. I either never knew it, which there's plenty of that, or I forgot it, and wait till you get old and push 70 years old. There's plenty that I've forgotten, or it's brand new. And the thing about medicine, folks, is that it's changing constantly. I read and study all the time. I spend hours every day on the emails that come into me for looking at studying stuff. For example, today, an article popped up for a drug called disulfiram. Some of you may know what that is. It's under the brand name Antabuse, which was to help folks get off of alcohol addiction. But the use of disulfiram to treat COVID lung conditions, that apparently it inhibits clustering of polymorphonuclear leukocytes, also known as neutrophils. It inhibits clustering of neutrophils that seem to be involved with causing inflammatory lung disease. Well, that came up today. I never heard that before. That's brand new stuff. I had a patient last week that came in with acute pancreatitis and was not a drinker. Pancreatitis is usually caused by either biliary tract disease or it's caused by folks who drink alcohol too much. But this person had neither condition. And it turned out that this person was on a drug called valproic acid, brand name is called Depakote. And it turns out that in rare situations, Depakote, valproic acid, can cause acute pancreatitis. It is rare, but we looked it up, and my resident and I both learned that right there in that situation. And so I think that as a medical school professor, we have the opportunity to fully admit that we don't know everything, but that we're committed to a lifelong learning. A typical day for us is a mixed one. What ends up happening in the medical school is that you have what's called a clinical or a physician working responsibility. And that physician responsibility requires that you go see patients. But you also have administrative responsibilities for which you have to, for example, right now I'm in the middle of what we call the faculty evaluation season, in which I have to actually interview 20 faculty and talk to them about their future role as professors in the medical school. And so a typical day for me then is a mixed one because I as a medical professor, have multiple responsibilities. Monty, are you still chiming out there, or is it still ringing along out there, or what? It must be.
Well, it is still ringing, but can you all hear me?
Yes, we can hear you just fine.
Fantastic. All right, I can keep going. I'm just not gonna have my video on because I am.
That's fine.
Who knew that I was going to have a presentation like this? This is beautiful.
Well, just rock on, buddy.
All right, sounds good. So so where was I? So extracurricular activities. And then I went to Yale to study medicine and business. I did a combined MD MBA. And one of the questions people always ask of me is, why the MBA? And so for me, the MBA is kind of a personal decision. And there was a few reasons. So one of them was what I title Money Talks. And so it is that I wanted to do the MBA in order to understand the financial aspects of decision making, especially in the hospital setting. We have, as doctors, as physicians, as PAs, as nurses, and as people in the health professions, your desire is to help people and to make a difference in people's lives. We bring in initiatives, but a lot of times, sometimes we don't bring them with a financial mindset. Like, how are the people at the top going to make money? Or how are the people at the top going to not lose a lot of money? And so I really, because of my desire to make a difference in other people's lives, I wanted to have a financial understanding of how to make things work out well for the hospital system, for the people that we serve, for the providers that are doing all the work. And so that was kind of one of the reasons I went into business school. The second one was due to community engagement. So, you know, I told you from the beginning, my parents were pastors. They did a lot of work really in the mission work. And one of the things they taught us from the beginning was the importance of building sustainable systems. So whatever you were doing, you were making sure that there was sustainability involved in that. And so, you know, they used to always give us this phrase: teach someone to fish and you feed them for a lifetime, give them fish and you feed them for a day. And so the goal was always to try to teach people to fish. And going to business school was very helpful for me because it helped me to have a mindset of thinking of how to create sustainable systems for people. The other one was the obvious thing. In med school, people learn about leadership. They learn leadership skills. They learn how to create a system that works for them. And so, oh my gosh.
Monty, that doesn't sound like a drill.
It doesn't sound like a drill.
Monty, are you okay? Is there smoke coming out of your building?
No, there is no smoke. There is nothing going on here. But I don't know why the fire alarm decided to go off at this time. So this is fantastic. I'm fine. There's a lot of people standing outside here. So we're good. Learning about leadership and also personal finance was something that was very, very important to me. And so those were some of the reasons why I went into business school.
Hey, Monty, was it not just personal finance, but the finance of medicine as well?
Absolutely. So that's kind of what I was talking about in the top, where it's the money talk. So how is the financial, how does whatever you're trying to do work towards the bottom line of the hospital system? How do the different groups of people, from the people and the emergency physicians, the radiologists, all these different groups, how do they work together in order to achieve the goals of the hospital system? Those were kinds of the things that I worked towards and learned a lot about in business school.
You know, it's interesting, Monty, that you and I work at a public hospital, which is funded by the county here. And so we don't worry a lot about ordering expensive tests and so forth, but because we know it's sort of absorbed by the community. But, you know, in the real private world that almost all the folks that are listening tonight will be entering down the road, you'll have to worry a great deal about whether or not the patients can afford the care that you want to order for them, right?
Absolutely.
All right. So you still with us?
I am here.
All right. Keep going.
Okay.
Well, Monty, about personal finance, did you have to borrow much money for school?
No, I actually went to school on a full ride scholarship. So I've never paid for school, thankfully. And we could talk a little bit about that. And, you know, just like I talked about earlier, it was about applying to as many scholarships, doing well in school, doing very well so you can be the best that you could be. And applying to a lot of scholarships was definitely very helpful because I was blessed to have gotten scholarships to achieve the dreams that I had.
Did you really have to write 14 essays for your scholarship application?
That's what I remember, the Gates Millennium Scholarship. They don't have that anymore. But yes, they were very short essays though. So it was definitely a lot of work, a lot of sending essays to people to read. But I am so grateful for all the mentors and the different people who were really committed to my success and helping me achieve my dreams.
Monty, you mentioned on the slide about system leadership. are you saying that there actually are leadership skills that you may not have just naturally known, but that you actually had to go to school to learn them?
Absolutely. There's a lot of these skills because one of the things we learn in business school are case studies. So you go through case studies looking at how, Coca-Cola or how Pepsi, or what is it about Southwest that makes them a place for customer service and the best place to work? Or what is it about all these organizations that make them a great place to work? And so business school was very exciting because it gave you that opportunity to see all these different companies, learn about what works, learn about what doesn't work, and learn about how to achieve change in your organization. I think these are very, very helpful. Now, can somebody learn these things externally, like by working in an organization? Yes, that's true. But a part of me was always thinking about how I could do and learn these things quickly.
Monty, I think back, I went home to practice medicine 41 years ago, and I took over an ER group and started doing the billing and collecting and all that stuff. And I made every mistake that you could make in business, and lost a lot of money here and there. Do you recommend getting a master's? Should all the students tonight who are, you have almost 330 kids online with you now, should they all get masters, or what should be the driving factor for them to get a master's in some subject?
I think it depends on what they want to do with their lives. So I was always interested in administration and health equity and building systems that were sustainable. And therefore, a master's degree was a no-brainer for me because I really wanted to hone in on those skills, to get to practice those skills and to be the best that I could be on it. Now, some people are not going for that. Some people are going because they want to be researchers. Getting a master's in public health, get a master's in health administration so you can do administrative research, or doing a bunch of programs right now. So like, for example, being at UT Southwestern and being in an organization like this, there's so many opportunities to take research courses so that even though you're not getting the formal training, you could get those courses after residency. You could get those courses when you're actually an attendant. You don't have to do it as a student. I chose to do it as a student because I knew exactly what I wanted and I knew exactly the educational aspects that I needed, and I wanted to go after it. In fact, I actually only applied to medical schools that had business schools associated with them because I kind of knew from the beginning that I wanted to go into business school.
Monty, you made a very difficult transition from your native country to America. What would you say really was the most valuable thing that you learned in that transition?
Oh, oof. Where do I start? Well, I kind of talked about it in the beginning about adversity. Going through a lot when we moved here where, kids made fun of us and different things happened. I learned the importance of fighting for what you think is right, fighting for what you think is important, and never letting adversity stop you from making a difference in the lives of others. And so I think that was one of the biggest lessons. The other lesson is constantly thinking about sustainability. So in this transition to the US, my parents were always teaching us about, whatever you do, thinking about how you can make it sustainable. So it's not a one-off, so that generations after you can still have a blueprint of what success is. And so in everything I do, I think about how I can make this last longer than I do, and that's kind of a lesson that I learned with this transition too.
I had one, I hope you don't mind all the questions early. Monty, how did you keep from burning out? Because clearly you were on a rocket ascending path. What kept you from burning out? Was it your friends? Was it your just gut level motivation and so forth? What kept you from burning out as a student?
Oh man, Um, when you figure that out, please let me know. But I think for me, it was, my faith in God is very important to me, and it gives me a lot of strength. And so, having faith and belief in something above yourself for me was very, very important. And knowing that, I was put into this world, not just for myself, but to help others. And so that kind of helps me. Also, just having, outlets, you know, like for me, my outlet, I love basketball. So I played basketball. My outlet was, sometimes just laying in bed and watching TV. So taking some time to just do that, taking some time to do exercise was very big for me. So like these are little things, service in, in my church community, having a family that, oh my gosh, having a strong support system. So my parents, my siblings, my girlfriend, there's just so many people who pour into my life and make my life way easier than I could have ever imagined.
So, Monty, you're obviously a man of faith. You have strong religious convictions. How did you navigate talking about your faith, especially when things are recommended so much to be, the word is secular, which is non-religious? How did you navigate that? Did you just keep your feelings to yourself, or how did you do that?
I think it's about not forcing anything on anybody. And so just because my faith drives me to want to be helpful to other people does not mean that I only am, helpful to people that are my faith. I don't talk openly as much about it, especially when I'm in an area where people are not receptive to it. So I'm very, very, selective of when I talk about it. But I think, regardless of anybody's belief, whenever you approach things in the way of, hey, I'm here just to help, it doesn't really matter what my motivation is. My motivation happens to be my faith, but I am here to help and I want to help. And people usually respond very well to that.
I have one last question, and then we can maybe go to your next slide. How in the world, you had a double major, right?
Yeah, I had a minor. So major in science, minor in psychology.
Okay. Do you think people should declare both a major and a minor, or a double major? What do you think? Any second thoughts about it?
Oh yeah. Oh no, I had no second thoughts. Oh my gosh, I'm so happy I did my major. I really enjoyed the mind. I enjoyed neuroscience. I enjoyed my psychology classes. It's about, I think college for me was, finding things that I enjoyed, and neuroscience and psychology just really were great for me. It was also at the time when I thought I wanted to be a neurosurgeon. And so it really fit very well in terms of the things I wanted to learn. Positive psychology was one of my favorite classes. And you hear me use it a lot in terms of thinking about positive reframing of things, where regardless of what situation a person goes through, always thinking about what is the lesson that can be learned about it. Also, good news, no more fire alarm.
Hey, Monty, you raised something. Being an admissions committee person, and also being around a lot of young people, many of them say from an early age, for example, the son of one of the folks that works in the apartment building where I live here in Dallas, already at 14 says, I'm going to be an anesthesiologist. And you go, you have no idea what an anesthesiologist does. Do you think it's important for students heading toward a medical situation, whether it's nursing practitioner or physician or whatever, to keep their mind open for a career that might interest them more than what they think they want to do when they start?
Absolutely. I 100% agree. I think it's very helpful to have something, at least something in mind. So like, for example, the 14-year-old who says, I want to be an anesthesiologist. That is fantastic. You might not know what an anesthesiologist is, but at least we had a starting ground. Now, first of all, you got to be a doctor. You got to be a medical student. You got to do well in undergrad. You got to do well in high school. All right, let's backtrack and figure out the paths towards it. Also, constantly asking yourself. So, for example, I thought I wanted to be a neurosurgeon. I remember when I had graduated, I had done very well. I was at an award show where the president of Nigeria, like I got to shake his hands because of all of the stuff I had done. And, there was that introduction, Nigeria's next neurosurgeon and whatever. And for me, I felt like there was so much pressure to do that. But when I got to my neurosurgery rotations and things, I didn't like it. And I was so scared. I felt like, oh my gosh, I'm gonna disappoint so many people who expected me to be this and that. Even today, there's people who still think I'm a neurosurgeon, even though I'm not. But I had to really stop and ask myself, am I going to fulfill other people's dreams for me and hate myself? Or am I going to pick something that I enjoy and love myself? And thankfully, I made the right decision and went for it. My point of all of this is to say that, yes, it is great to have aspirations, but it's very important to also keep one's mind open, looking at the things that really work for you, looking at the things that you like, that you enjoy, and then gravitating towards a specialty that works for that. The one other caveat I would say is that there is no perfect specialty. Dr. Fowler, you've been doing this for a long time. If I asked you to list the things you hated about emergency medicine in one hand, you'd probably say that. I don't think there's anybody who can say they love everything completely about their jobs. The goal is finding a job that really works for you, that you love a lot of things about it, and that you can work with and feel like you're making a difference in the lives of other people.
Hey, Monty, let me take that since you brought it up. The two things I hate about at least what I do is it's very hard to provide medications for patients sometimes, especially if they don't have insurance. Now, if they are indigent, we have a county funding program, as you know, called Parkland Financial Assistance. But it may be impossible to arrange for office visits for follow-up, what we call aftercare. It may be impossible. And so that's one of the things that I hate when I get so frustrated is that so many patients come to the emergency department because they have nowhere to go. And we do the best we can, but then arranging follow-up, the best thing I could say sometimes is come back to the ER if ... you have the following problem. You know what I mean?
Yeah, absolutely.
Please continue, Doc.
Yes. Whew. I'm so happy. No more loud fire alarms.
Any smoke in the building, Manny?
No, you can't make this up.
No, that's great.
So got the MD and the MBA, went to residency, stayed at Yale for residency, which was a fantastic time, 4-year program. And most of my stuff was related to health equity and advocacy, and these pictures just show I organized a health voter registration and health summit last year in collaboration with the president of the hospital system. And that was a fantastic opportunity to be able to help people have their exercise their civic duties while also taking care of their health. So like needle exchanges that were needed, talking about substance abuse, giving vaccines for the flu, and this was before COVID vaccines were out and all of that stuff. So it was too much work planning, but it was a lot of fun doing. I do a lot of outreach. So this was our outreach of Meharry and the SNMA for those who are people of color in medicine as an organization. I do a lot of advocacy and podcasts and then a lot of public speaking. So those were kind of the things that I spent a lot of time doing while at Yale. So for a while, I thought I was going to be a Yale lifer. I was going to spend all my time at Yale, but then towards the end of residency, I began to realize how I wanted to really be closer to family, closer to my girlfriend. And so I moved to Texas. Here's my beautiful family. And thankfully, I got into UT Southwestern to work as an attendant in the middle of the pandemic. I think this is my first shift at UT Southwestern. And it's been a fantastic time so far. So I will pause for a few minutes. I think I've answered a lot of questions, and then we can go to the next step of microaggressions.
We have a bunch of questions. So Aditya, take it away.
Yes, so we have gotten a few questions. Dr. Fowler's already asked a few of the good ones, but we'll ask this one that just came into the chat. How would you address the primary care physician shortage while keeping in mind health inequities for minorities, the uninsured, and etc.?
Oh wow, that's a big question. And the question, and I hate to answer a question with a question, but is the question, how does the health system address the primary care shortage? Because that's a difficulty we've been having, or the healthcare system has been having so far, because of the incentives do not match, unfortunately, for people going into primary care. One of the good things that has come out of it is we have a lot of APPs who go into primary care, and that kind of help a little bit to alleviate the shortage that's going on. But inequities of care, oh my gosh, that's something that we can talk for hours about. But I think the most important thing is incentivizing people to go into fields including primary care. Unfortunately, I don't think those incentives are aligned at the moment. And I hope they get to that point.
Next up, how did you select your major at Johns Hopkins? And what were some time management methods that you integrated to maintain your academic and extracurricular commitments?
Oh, wow. So how I chose my major. So I came in biomedical engineering, at least thinking about biomedical engineering. Because I like math a lot, but I realized after taking my first intro to neuroscience class with the same professor who ended up becoming my mentor, I was hooked. I just loved learning about the nervous system, learning about its relationship with the mind. I just love that intersection between neuroscience and psychology. And a lot of the work I'm going to be doing more of, one of the things I didn't talk about was, I focus in business school was looking at behavioral economics and using nudge theories to help with behavior change. And so I'm still using a lot of the knowledge that I learned in undergrad and then in business school to exert change in the healthcare system. So how I chose my major, that's kind of how. The second question is time management tips. I think some of them are having a schedule and trying to stick to it as much as you can. There's a million things that come to try to distract you, whether it's, Netflix or whatever it is. Knowing yourself and knowing that, for me, I know that if I start a show that's really good, I'm going to watch all of it. So I try not to start any new shows when I don't have time, because I know it's just going to be a wash. I'm going to watch all of it. So knowing yourself. And then making that plan. The second thing is, having, in the beginning of the semester, I always had a schedule of when all of my exams were. So I would write them down in my calendar. And that kind of helped me know that, hey, by the way, in November, you have 4 finals that are on the same day. And instead of waiting till 2 weeks before to freak out about 4 finals that are on the same day, I was already planning and studying for those exams, knowing that, oh, if this is a class that has 4 exams, then I know that I need to do really well on the first 3 so that I have a little bit more wiggle room on the 4th one because I have 3 other exams on that same day. So it takes a lot of planning that goes with it, and being very intentional about your time, being very intentional about your time with family too, and your time with the things that, Dr. Fowler had asked me earlier about the things that keep me from burning out. My time playing basketball, my time being around my support system, my time at church, making sure that you plan those things around, put those things in your schedule so that you feel fed, so that you feel, you feel like you are not burning out.
Okay, maybe 1 or 2 more. At this stage in your life, what do you see as your mission as a doctor right now? And how has this changed since you were in medical school, maybe?
Wow, these are some deep questions. What is my mission? My mission is, actually this, my my mentor, Dr. Hendry, he gave me a book in undergrad, The Words of the Founding Fathers. And in it, he wrote a quote: "You are here to do whatever it is you do, not because it makes you feel good, but because it helps you make a difference in the lives of others." So my mission is to use medicine as a pathway to make a difference. And one of the areas I've been thinking about is health equity. And so a lot of the work I've been doing has been in terms of education and advocacy related to issues related to gender, related to race, and medicine. These are thankfully, it's at a time that people are actually interested in hearing about these things and hearing about the experiences of minorities. And so it's very opportune that, I am in this environment and able to do work that I do and able to have a department at UT Southwestern that supports me to do stuff like this. I'm really blessed to have that.
Okay, one last question. What was the hardest part of your journey after medical school, and how did you deal with it? Or if it's something that you're dealing with now, how are you coping with it?
I'm going to talk about that next.
Sounds good. Take it away. We can move on
Fantastic.
to the presentation.
Fantastic. All right. So what do I do now? So one of the things I focus my attention on is microaggression. So I think, we talk about this a lot. For those who don't know, these are brief, commonplace indignities that communicate hostile, derogatory, or negative slights to target groups of people. This is a picture, and this is a video, you can actually look it up, of the mosquito analogy of microaggressions. And it talks about how, many of us, if one mosquito bites you, you're like, nothing. When you have a mosquito biting you every second, if you have multiple biting you throughout the day, then eventually it becomes more of a nuisance. You begin to notice it. That's kind of how microaggression, that's kind of what the name comes from, where even though these might be seemingly negative slights, they might not be as big of a deal as people would say. When people experience this on a regular basis, on a daily basis, it begins to add up, and it becomes one of those things that makes for a hostile work environment. So there are multiple forms. They can be based on race, they can be based on sexual orientation, they can be based on gender, and they can be based on name. So microaggressions have a lot of negative effects. So they have negative effects on mental health of the people. They've been associated with depression, anxiety, physical health. They've been associated with hypertension, obesity, and they can be, they have negative effects on bystanders, where even though you specifically, so Aditya, for example, if I were committing a microaggression against Aditya and Dr. Fowler was witnessing it, he could have negative effects associated with it, despite him not being the victim of it. So there's multiple victims, and imagine the multiplier effect that occurs when there's so many people witnessing microaggressions and these aren't corrected. So microaggressions can also lead to burnout. And anyone who talks about medicine these days talks about burnout and how, even Dr. Fowler's talking about it, and how to eradicate it. And so it becomes a very, very important thing to find ways to stop it, because microaggressions can lead to burnout. Burnout leads to turnover, and turnover of a physician is really, really expensive. So did you know that it can cost up to $500,000 to $1 million to replace a physician who just left the hospital system? And this is not just with them leaving, it's because of the productivity that goes away, because someone's been there for a while. They know how the system works. Now you're getting a new person who doesn't know how the system works, because of the loss of patience that might occur, because of the cost of searching for a new person, because of the cost of training them to be able to get up to speed. So all these things make it important that we should work towards eliminating microaggressions as much as we can. So I wrote this piece in the Annals of Emergency Medicine. You guys should definitely check it out. It's titled "Say Our Names, We're Doctors Too." And one of the things I talked about was name-based microaggressions. So name-based microaggressions are a subset of microaggressions that captures the discriminatory actions against those whose names do not conform to mainstream standards. So for example, I remember, so what I talked about in the article was a story of me walking into the emergency department. In the ED, I don't know how many people, I wish this was in person, it's been so great, but virtual is great too. But, where, I would poll how many people have been to the ED. I assume some of you have. You walk in and there's a sick patient and you have the senior residents. You might have, in my residence, we had 2 junior residents, and then we had the attendant. The attendant introduced herself to the patient. "Hi, I'm Dr. Jones." She introduced the other 2 residents. "These are Dr. Jonas and Dr. Johnson." I'm making up names. And then she turned to me, "And this is Manny." And I paused for a second. I gulped, thinking, hey, why did she call these people doctors and not me? And then it brought back memories of the many times throughout residency where, whether it was a lecture hall, whether it was a small group gathering, it was always Dr. Jonas, Dr. Johnson, Dr. Smith, Dr. Stephen, and Manny. And I realized that these people were not really trying to cause harm to me. They just could not pronounce my name and did not make any effort to. However, before I realized this, I had a lot of problems that affected me. It caused imposter syndrome. It caused me to have anxiety because, every time I would come into the clinic, especially being a resident, it's always, everyone's referring to you by Dr. this, Dr. that. So every time it didn't happen, it was like a mosquito bite, just hitting you, boom, 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 constantly everywhere you went. It became, you start feeling like an imposter despite doing so well all my life, getting the top scores and everything I'd done. I still felt like I wasn't good enough. And then the lack of recognition that came with it, where you would have patients who would commend people, because Dr. Smith is very easy to remember. So when they would write whatever, they were like, Dr. Smith was fantastic. But when it was a patient or a patient scenario that sounded like mine, it would be like the team was great because they don't remember the person's name. So I wrestled with this for a long time. And then I realized that it wasn't just me. There were so many people who had experiences like this. Name-based microaggressions are in society. We have it in education. We have it in job applications. There's a landmark study about racialized names and how these people received less callbacks for jobs. And this still occurs. There was a repeat of the study in 2021, and it still occurs today. We have it in healthcare in terms of mental health professions, calling back people. We have it in the courtrooms where jury assumptions and case judgments are influenced by the names of the people. We have name bias and recognition. I thought this was pretty funny. One where, they gave an example of a person who was picking raffle tickets for people to win a lot of money. And, someone observed them, like literally picked the name and was like, I can't pronounce this, put it back, pick the name until they found a name that they pronounce. Now, people are missing out on opportunities like that because you missed out because someone refused to try to say your name. Name-based microaggressions lead to differential use of formality. Just like my experience, this has been shown in other studies especially related to gender bias, where females were less likely to be called doctor than their male counterparts when there was an introduction. So in all of these, we have to remember that intent does not equal impact. And so just because someone commits this, just because someone does this, does not mean that they're a bad person. It just means that they have opportunities for being better and for showing the effort that's required in order to make life easier for all the people around. Now, one of the things that a lot of people say to me when I talk about this is this. So if you can put on your thing, just click on your thing, the raise hand buttons. How many people are bad with names? Oh yeah, look at this. I love it. I want to pick on someone. So there's a lot of you here. I see Natasha Akomia. Oh, can people be unmuted? Can people unmute? Is it okay?
I can fix that right now. Let me just allow her
Yeah.
to be unmuted.
I assume.
Natasha, you should be able to talk now.
Yeah, hi.
Hi, Natasha. How are you doing?
I'm doing great, thank you.
Fantastic. Are you bad with names?
Yeah, I am.
Okay. Seems like there's a lot of you. Who's this? Can you see the picture?
Yeah, I can see.
Do you know who this is?
Yeah.
Who is it?
I'm actually having a hard time remembering his name right now.
Did someone want to help her?
Oh, here we go, Matthew McConaughey.
Oh my gosh, fantastic. All right, who's this?
Oh, goodness.
Don't you love being on the spot?
Yeah.
Good.
Okay, yeah. Arnold Schwarzenegger.
Oh my gosh.
Yeah.
How did you learn their names?
I've heard people say it a lot.
Ah,
Watch
exactly.
a bunch of their movies.
But
Yeah.
these are difficult names. McConaughey, Schwarzenegger. I'm gonna post it in a little bit, but you learn the names. So one of the things I was talking about was part of it is hearing it and then learning it and then practicing it. So the mnemonic I put in was ALP, ask, learn, practice. When you encounter a name that is different or that you're not familiar with, it takes 5 seconds. You ask them, you learn it, you practice a couple of times, and you'll be surprised how it becomes easy for you. So you immediately know that just like you can say McConaughey, just like you can say Schwarzenegger, you can say Ohabunwa. Right, Natasha? Oh, I think she's scared or she got muted. So that's kind of what I was talking about. So ALP, ask, learn, practice, whenever you encounter a name that's different. The other thing is email signatures. So you can have social media signatures. So I have one where I use Name Coach. So I ask all of you to go on the website, Name Coach. I have no financial or any relationship with them. And then you make a name badge of your name so that when someone clicks on it, so if you look at my signature, you click on it, and then Manny Ohabunwa, it says my name immediately. And so it takes away the ALP, the ask part of it, so that you hear it, you learn it, and you practice it. Aditya, did you use the Name Coach?
Yes, I did, but I do remember meeting you a few weeks ago and you had told me how to say your name, so I somehow ingrained it in my memory.
Fantastic. And that's kind of how, so the two things I ask of you today are one, ALP. So whenever you encounter a name that you feel is different from what you're used to, just ask. I'm sure they will appreciate you asking. And the other thing is to normalize using names, email signatures like name coach, or any other form of it, so that it becomes easier for people to hear the accurate pronunciation of your name and not be scared to actually say it. Okay, can you guys do those two asks for me? I just need a raise of hands if you can do that for me. Fantastic, I love it, I see it. Thank you so much. And that's all I got. I'm happy to answer any questions, and please fill out the survey that Aditya is gonna send to you.
So I'll send the survey in 1 second. While I'm grabbing the link for that, could you answer this question? Sometimes, this is a student in the chat. Sometimes I experience name-based microaggressions. How do you handle them when it seems like it's so out of control and sometimes can feel hopeless?
That's very true. In a different session, I usually talk about the different ways that one can handle it. One of the ways is first having that, taking away any assumption that anybody means harm from this. And then secondly, encouraging. So like walking on to people. So, just thinking about my experience, for example, one thing I could have done was realize, when I walked into that trauma room and the attendant was introducing, I realized very quickly that the person probably didn't know how to say my name. So I could have just been like, hey, I am Dr. Oha Bunwa. Nice to meet you. And that kind of makes it so that when a person hears it the first time, it makes it a little bit easier for them to learn. The second thing is having named something like this in your email signature. So I hear a lot of people talk to me about it where they're like, I played your name a few times and then I learned it. And so when you give people the opportunity to be able to hear it, then it no longer becomes foreign. So it becomes like Schwarzenegger, it becomes like McConaughey, where they've heard it so many times that it becomes ingrained in them. And that's kind of the learning theory principle that we don't give people the opportunity to do when we don't give them opportunities to hear our names. The other one is to have a phonetic spelling of your name and wherever, just giving people the opportunity to hear it, because the more likely they hear it, the more likely they are to say it.
Could you also repeat the name of the website for the name signature?
Yeah, so the one I use is Name Coach. You can use any website you want, but I use Name Coach because it's free. And you can do a name badge. So literally Google name coach and it comes up, and you can make a name badge with your name and then attach the link to your signature for your emails, for whatever. Also, I don't know if you guys have realized this, but LinkedIn has a pronunciation thing on your name. So like you can record your name, and if you click on my LinkedIn profile, you can see on the right side, hear how to say my name, and it immediately says it. So whatever it is, the goal is to try to get it out there so that people hear it and no longer feel scared to try and say it correctly.
I think that covers most of the questions that we have for you, Dr. Fowler. Do you have any of your own that you'd like to ask?
Monty, that's very interesting. And what I'm wondering is, when this first happened to you, the first time that there was this pronunciation challenge, or even where you felt demeaned because someone didn't try to pronounce your name, how did that make you feel? You covered it a little bit, but deep inside, how did it make you feel? Were you angry? Did you, how did you feel?
Initially, it's like the mosquito bites I talked about. The initial times, I didn't feel anything. I was just like, whatever, keep it moving. I think eventually it begins to, when it happens everywhere you go, then you start questioning yourself. You start saying, am I not supposed to be, am I not a doctor too? Because it's usually related to them calling you by your first name or just Dr. O, and it's like it just affects your relationship with the other providers. Because you literally hear them say a lot of other names without even thinking. I remember hearing someone the other day, we were talking, and they were like, can you say your name? And I was like, Ohabunwa. They were like, I will never learn to say that. And then 5 seconds later, they were like, Villanueva, Oshagnesi, come to the front. And in my mind, I'm like, oh my gosh.
All right, Monty, let me flip it on its head. At
Please.
Parkland, we have a real slice of life. We're 30 minutes from an international airport, and we see all kinds of people with Arabic names.
Mhm.
They are Chinese, they are, pick one, that have complicated names. How do you, having been through this, avoid the reverse microaggression to the patient?
Exactly.
How do you approach that when they have a long, what appears to be difficult name to pronounce?
I always ALP. I ask, I learn, and I practice. I literally walk in and say, hi, how do I say your name? Or I say, hi, I'm just thinking of a name. I might just be like, Ohabunwa. Did I say it correctly? And then they're like, no, say it this way. And I'm like, okay, thank you. And I say it in me, and I practice it, and I say it. And the number of times I have a patient who is just so happy, you see their eyes light up. It's like, the name is one of the sweetest sounds that a person hears, their name. And so the way they just feel recognized, like they are there and they're present. And it just affects the way that the rest of the patient doctor relationship goes about in a positive light.
Well, I think that concludes all the questions that we do have. Thank you so much, Dr. Oabunwa. All the students are very thankful for you enlightening them on something that many of us, me included, did not know too much about. Could you please go to the next slide? I'm not sure if you were able to add.
But Monty, actually go, well, you can leave it there. Monty, before the talk, you and I talked a little bit about other microaggressions. For example, I shared with you an article I got today on this very subject, and it had to do with a female physician. And this particular physician wrote about some of the things that she had heard from patients. Mm-hmm. For example, a patient seeing the female physician said, well, I hope to go to medical school too. It's cool to see that you could do it. Mm-hmm. Or another one said, well, it's ladies running the show tonight. Or another one said, you're clearly a mama. And then finally, of course, the one that so many female physicians hear, well, are you the nurse or the doctor? Mm-hmm. And so, Monty, I guess maybe to wrap up this part, speaking in a broader context, what is the message that you would take to these young pre-healthcare students? You've got nearly 340 students hanging on every word you're saying. What message, if you were to give them a one-liner about them as individuals and making their way, about how to put up with the small microaggressions and to make their path, do you have any sort of last word comments in leading them to their future?
Oh, absolutely. I think, for as we go, unfortunately, we're in a society that is moving forward, that's going in the right direction, I must say, but where, certain people are still not assumed to be the doctor. I know I was talking about earlier where I get called, I'm the tech person, or I'm the person, the transport person sometimes. So I got this sign that says doctor on it. Unfortunately, we are in a society where this happens. And the question is how you're going to deal with it. I think dealing with it head on in a respectful, always respectful way kind of helps, because a lot of the times, like I talked about, people don't realize how their actions affect you. The other thing is just also not letting adversity stop you from achieving your goal. And so, just because this thing is happening wouldn't stop you from being the best doctor that you can be. If anything, it should push you to be the best physician, the best PA, the best nurse practitioner that you can be. Nevertheless, using whatever platform you have in order to advocate for the people that work with you. For example, if you're a male doctor or a male physician and your female physician is being called nurse, and nothing against nurses, my sister is a nurse. I love a lot of nurses, nothing against nurses, but I'm just saying, if people aren't being addressed in their correct position, one thing is very helpful is to speak up and say, hey, I know you don't mean this, but when you address this person who's clearly a physician as a technician or as a nurse or as a this, you are disrespecting their hard-earned degree. Just something very nice, and never assuming that the person was trying to do it negatively, because I assume and I hope that most people who we work with are all well-meaning people who are focused on doing the best for you and for your patients.
And Monty, I think probably the highest compliment for this terrific talk you've given us this evening was from Tanushree, who said, can you please ask him if he'd be willing to mentor students at this seminar? So you've already got people who want to just hang on your every word. So
absolutely.
Well, thank you, Monty. Aditya, what do you have for us?
Oh, just quick, if you want to just hit me up on Twitter at Dr._Emmanuel. Happy to connect and happy to share resources as much as I can.
Thank you, Monty. That was great. Aditya, you want to take us through the end here?
Yes, sir. So here's our quiz information for this session, session 91. Here's a QR code that you can scan. I'll also be sending the link in chat right now for today's quiz, as well as a past session quiz. The quiz for tonight's session will be due next week by 6:59 p.m. And for the past session quiz, there's no set due date on it, but those of you that stick around till the end, here's the link. Let me send it one more time. And let me also send the survey link for Dr. Ohabunwa's survey, so you guys can complete that. Alrighty, everything should be in the chat.
So everybody take those down. Let's wait 5 seconds. Everybody copy those down. And now, would everybody please put thank you, Dr. Ohabunwa, into chat so that he can see 300 thank yous come pouring in, Monty, from very, very grateful students who are all over the world tonight. And you have touched many, many hearts. Monty, we're going to put this online, and there will be probably 5,000 pre-healthcare students that'll watch this when it's posted online. Each one of those, Monty, will have their own careers. Each one of them will see 100,000 patients in their career. 5,000 times 100,000 is 500 million lives that you have touched tonight by coming and sharing your sweet heart with us. We are so grateful. You just have done a marvelous job tonight. And I hope that the outpouring of thank yous that you saw gives just a tiny little touch of how very much we appreciate it. Well, ladies and gentlemen, this is Virtual Shadowing. We appreciate you coming. We're going to be here next week with a marvelous session with Dr. Wynn, whom you will thoroughly enjoy. He's almost as good looking as Dr. Ohabunwa, almost, but not quite. But you will really enjoy next week. We have some great sessions coming up, including the past chair of the admissions committee will be coming up in May. So stay tuned to all of these because we're Virtual Shadowing. And on behalf of Dr. Ohabunwa and the entire Virtual Shadowing Working Group, we're so grateful that you came. And for that, we wish you a good evening and we wish you a good night. Thank you for coming.